Nobody teaches you the unwritten rules of the ambulance service. They're not taught at university, they're not written in JRCALC, but if you break them, everyone will know about it. Welcome back to another episode of Paramedic TV. My name's Tommy and this is presented by Pocket Clinician. So in this video, I thought I would talk about the unwritten rules of the ambulance service because there's lots of things that are pretty obvious, like wiping the bed down after a patient, doing a set of observations on everyone that we see, etc, etc. But there's a few things that we should know that not everybody does. It's just basic ambulance etiquette, so hopefully this will teach you a little bit of it. So the first unwritten rule of working for the ambulance service is asking your crewmate what they want to do first. So as you walk into the ambulance station and you see your crewmate prepping the truck or sorting out the drugs or anything that they might be doing, it's general etiquette to ask what they want to do first. And what I mean by this is whether they want to attend or drive first. I'm not sure if it's just me, but it kind of grinds my gears a little bit when I come in and my crewmate has just plastered all of their stuff on the attendant seat without really checking who wants to do what first. Now, I'm pretty easygoing. If someone wants to attend first, yeah, crack on. If they want to drive first, I really don't mind. But it's just the principle of it. Just ask. Or you could even mention that you want to drive first or attend first. You know, we all have our different energy levels in the morning or the evening, and that's completely acceptable. If you are someone who needs to drive first to just wake up, then that's absolutely fine. Explain it to your crewmate. But generally, it is good etiquette to have that discussion at the start of your shift. So there's a couple of things you can do. So you can either do half and half, so you'll attend or drive up to the halfway point of the shift and then swap round. Or my favourite is job about. So don't hate on me for this, but my preferred way of working is to swap after every job. Let me know if that's your nightmare, but for me, it makes the shift go faster and you just spend less time feeling bored driving around doing obs on patients for 6 hours. Now, even for me, I will always ask my crewmate, do you want to job about or do you prefer half and half? And if they prefer doing half and half, of course, we'll do half and half. I'm not going to break their back making them do job about, which it sort of traditionally isn't really a way to work in the ambulance service, but I think it's becoming a little bit more modern and cultured in a lot of ambulance trusts. So yeah, I think the quickest way to get on your crewmate's nerves is just assuming the driver's seat or the attendant seat without having that brief discussion before you start. The next unwritten rule is just leave the truck how you'd like to find it. I see it time and time again where I get onto an ambulance and there's still rubbish in the clinical waste bin, there's stock that's missing from the ambulance, and for me, I just think that it's not particularly respectful to your fellow colleagues if you just leave the truck in an absolute state. I've seen it all. I've seen blood on the scoop. I mean, ugh. Just clean it up. It's really not difficult. And fair enough, you know, if you're an hour late off and you think, do you know what, I'm so tired, I cannot think about restocking this truck or cleaning it up or whatever, then just put a little note on the driver's seat or the steering wheel saying, hey, we were 1 hour late off, I'm sorry for the mess. And people will understand. So yeah, at the end of your shift, just make sure that you empty all of the bins, clean all of the kit, restock oxygen masks or other bits of equipment that you might have used, and just leave the ambulance in a condition that you would want to find it in. Your shift may have finished, but the truck hasn't. That's going to go straight back out on the road going to see patients. I think one of the biggest things that we need to know about is that the mess room does have eyes and ears. Now, what does that mean? So we often go to the mess room and have really personal chats with our colleagues. It could be about personal things. It could be about another colleague. But just remember, there could be someone lying down on that sofa that you can't see that's earing into your conversation. So if you do want to have those gossips or personal conversations, I would just do a little once around the mess room just to make sure that there's no one in there hearing what you're saying. Because let's face it, in the ambulance service, gossip spreads quickly and what you say will get repeated and maybe even changed around a little bit to be spread around as a rumour that you might not have even said. I walked into the mess room once and there were two people sort of slagging off another member of staff, and they didn't hear me come in. Now, their back was facing the door, so they didn't even hear that I'd come in. All I wanted to do was fill up my water bottle. Now, I'm not a massive gossip or a rumour spreader or anything like that, so I just let it go in one ear and out the other. But there are definitely people that would have sat there, listened to what you were saying, and then spread it like wildfire. So yeah, just think about it. Ambulance stations, they're like tiny little worlds, and things spread, things get heard, and often the walls are quite thin as well. So even if there's someone in like an adjacent room, they might be able to hear you talking about whatever you're talking about. So maybe just keep your chat to the cab or outside in the garden, or maybe just text each other, I don't know. Next up on the unwritten rule list is don't be hard work. Now, we've all worked with those crewmates who are constantly negative, they argue about everything, they're not particularly the most empathetic people to patients, and it really doesn't make the shift go smoothly, fast, or you don't finish thinking, do you know what, that was quite a good shift that I had with that person today. I've worked with people before who, when we get a job, and it might be a obvious low acuity job, literally like a stub toe or something, and my crewmate has rung up control and beated down a load of abuse down the radio saying how we shouldn't be going to this job, why are you sending us this? And essentially, the dispatcher doesn't really have much control over it. You know, if a job gets categorised as an ambulance response, they have to send an ambulance, and there's no point in hurling abuse at them because it's not going to change anything. But I felt so awkward in that situation. I was driving to the job thinking, what on earth is going on? There is no need to be shouting at the dispatcher like that, or even moaning about the job. Just go there, treat the stub toe, get on with it, and then move on to the next one. Sometimes I think that actually the lower acuity jobs is a nice little break from what we're normally getting sent out to, like the heavy lifts or the difficult extrications and things like that. So if you do go to a 20-year-old with a stub toe, treat it as a little break. You know, the patient is likely young, they're going to walk, you know, they might not need to go to hospital, and it's just, yeah, it's just an easy job. The other thing that I find difficult about the people who make it hard work is even the simple things, they make it a challenge. Why do they do that? Like extricating a patient that's in their living room who, I don't know, got hip pain or whatever. If they need a chair, okay, that's fine. Just get the chair, pop them in it nice and slowly and safely, and wheel them out. But some people love to make a big deal out of it, going back to the ambulance, going, oh, this is this, and this is annoying, why are we doing this? And then they bring the chair out, they get all aggy with the patient, saying, come on, get in the chair. Or, you know, the thing that I hate the most is when you go to like a 99-year-old patient and they go, can you walk to the ambulance, love? And you just think, man, she's 99. Give her a break. And she's frail, she's light. You're not going to do your back in carrying her to the ambulance. It's really not hard. And our job is to put people at ease, reassure them, and just put them in the chair and take them to the bloody ambulance. The other thing I see a lot is ambulance crews, they come to the hospital and they say to the other ambulance crews, oh, I don't know why my patient's here. And I think, well, you brought them here, so why are you moaning about it? You've obviously thought of a appropriate reason to convey them to an emergency department, so you can't then take them there and then moan about why they're in the hospital. Now, I do get it. On the rare occasion, you're going to go to a patient who you say, look, hospital isn't actually appropriate. I think you should go and see your GP, or you should just sit at home, take some paracetamol and see how you go. And they plead with you, no, I really need to go to hospital. I want to get it done. And no matter what you do or say, their goal is hospital. So yeah, there are going to be some people that you take to hospital inappropriately, but that is rare. I think in the 8 years I've been on the road, it's happened to me a handful of times. So yeah, if you've taken a patient in, don't go around saying, oh, I don't know why my patient's here. I've never really understood it. So I said that I would be announcing the winner of this amazing giveaway. Now, there was a slight issue with that in that every single one of my subscribers have their toggle on private, so anyone who they subscribe to can't see that they've subscribed to them. So here are some instructions on how to make your thing on your channel public so that I can then see and potentially choose you as a winner for the Student Paramedic Bundle. So open up YouTube and go to your account in the top right hand corner. You want to go down to the Settings tab, and once that opens you'll see a list on the left hand side. Click Privacy, and then you'll see Subscriptions and a little thing that says keep all my subscriptions private. You want to make sure that that is off. So if you could all do that for me, I will be able to actually choose someone to win the bundle. Don't forget, if you like what you're seeing and hearing, then press that subscribe button and the notification so that you know every time I post a video. So the next unwritten rule is quite a big one. It's let the attendant attend. This is so common and it grinds my gears a lot when I'm attending and we walk into a patient's house and my crewmate starts the introduction and starts trying to take a history. And I sit back and think to myself, okay, well, there is a clear job description here when you're driving or a passenger. And when you're driving, you sit back, do a set of obs and don't really say much unless there's something really pertinent or important to say. And if you're a passenger, that's when you take the history, you make the treatment plans, etc., etc. So why on earth do you feel, as the driver, to start butting in, asking questions and talking over the person who's meant to be attending? Now, I get it. I'm a paramedic. If I'm working with a emergency care assistant or a technician and we go to a high acuity patient that requires emergency paramedic interventions and I'm driving, then yeah, I'm going to take over the job, and that is completely normal. I started in the ambulance service as essentially an emergency care assistant, and that happened quite a lot. I would walk in thinking I was going to be the attendant on that job, and my paramedic crewmate would completely take over the job and administer the treatment, get a quick history, and then make a treatment plan. But that's the job, you know, if you're working with someone who's a higher clinical grade, then that will happen from time to time. But I'm not talking about that. I am talking about your basic falls with no injuries, your low risk chest pains. If you're the driver, just be quiet. Shh. I've even seen it before where my crewmate has started giving a diagnosis after only being there for 30 seconds. And I get it, because a lot of people become a bit jaded with what comes down on the MDT screen now. And it will say, oh, you know, 50-year-old cough with yellow phlegm. And they're like, right, that's a chest infection. We can refer that to the GP. Well, yeah, that's fair enough. But actually, we need to do a full assessment and actually look at this patient before we make those kind of decisions. So I will arrive as the attendant and I'll be listening to the lungs. And whilst I'm doing that, my crewmate turns around and says, well, you got a chest infection. Have you seen your GP about this? And I think to myself, okay, well, we don't know that. It could be a pleural effusion. It could be a pneumonia that we actually need to take to hospital. So yeah, I'll stop banging on about it. But essentially, if you're the driver, then just sit back, relax, and only jump in if you really need to, not just for the sake of it, because it puts off your crewmate and it can run them off their train of thought. And if you've got a crewmate who's attending who's fairly new, they might lose confidence when someone takes over and then they go back into their shell and they struggle to progress as the clinician that they want to be. And that swiftly moves us on to the next unwritten rule, which are driver's duties are actually a thing. So when you're a passenger, you have your duties to attend, get the history, make a treatment plan, and all of that jazz that I just explained. But, you know, the driver doesn't just drive. There's a lot of things to do here. You need to do the sets of observations. You might want to set up a nebulizer. You might need to do the ECG. You might need to get equipment out back from the ambulance to assist with the extrication of the patient. And that's fairly standard. But after that job is done, your driver's duties doesn't stop there. You've got to put the bed back into the ambulance, clean it down, restock all of the bags with the oxygen masks or the OP airway that you might have got out or used. Clean up the floor if there's, I don't know, tourniquets or wipes or BM lancets knocking about on the floor. Just pick it up and pop it in the bin. And I've seen it before. I've been attending, we hand over the patient and I've got a bit more paperwork to do because we blue lighted the patient to hospital or whatever. And I'll sit in the passenger seat and then the driver will come back in and sit on the driver's seat. And I'll be thinking, bloody hell, they sorted the truck out quickly. It was a bit of a tip. And I'll say to them, do you need a hand in the back? And they'll say, oh, no, I'll do it in a minute. And I think, well, we've only got 14 minutes to turn this around. Really, you wanna be doing it now. And if you want a hand, let me know and I'll give you some help. So yeah, if you're the driver, remember your driver's duties. Do the set of obs, get the extrication kit, and then after the job, clean up the truck, put the rubbish in the bin and restock those bags so that you've got the right amount of stock ready to see your next patient. And the last thing that I want to talk about, which I think sort of sums up a bit of everything, is never forget what it feels like to be new. Now, whether you're 6 months in, 5 years in, or 30 years in, we were all on our first day once. And I think that people forget that and they work with a brand new person and they expect a little bit too much of them. Whether it's the way that they attend, whether it's the way that they conduct themselves in the mess room, you can't expect someone on their first day to completely integrate themselves within the ambulance station culture of, chatting in the mess room and asking everyone if they want a cup of tea, etc. Because it's difficult to do that. So just remember that every paramedic was once nervous. And if you're in this position now where you're quite new, then just remember that you will get to a point after a few months or a year where you feel confident and happy about your current sort of feeling within your job. You'll feel pretty confident and you'll feel like, do you know what? I'm not coming into work worrying about what I'm going to see today. And that's a good place to be. But if you're working with someone new, then you've got to remember what you felt like on your first day and ask yourself these questions. What did I need on my first day to make me feel at ease? Was there anything that my crewmate could have done on the jobs to make things a bit easier for me? And how did you feel when you walked into the mess room with 20 people that you didn't know? So think about those questions, and when you work with that new person, just treat them how you wanted to be treated yourself when you were brand new. We've all made those stupid mistakes. I remember when I was fairly new, I was trying to set up a nebulizer, and I don't know how I did this, but I started screwing it on, thought it was all done, put it on the patient, and then the nebulizer actually dropped from the mask and the salbutamol went all over the patient. And I felt like an absolute idiot. And my crewmate was really nice and they said, oh, don't worry about it. I've done that before, even though she probably hadn't. And yeah, we just set up another nebulizer, popped it in and it was all done. But I can imagine that for some people, they can be made to feel really bad about that. So yeah, even the little mistakes, we've all done them before, like not knowing how to take the life pack out, not knowing how to set up the suction, or even me dropping the nebulizer out of its screw thing. These things happen, so just understand that and take it easy on them. And if you've got anything to say about this video, or if you've got a question, pop it in the comments and I'll review it when I can. And lastly, if you want all of the best tips, tricks, and products on offer for student paramedics and ambulance clinicians, then head over to pocketclinician.co.uk to really ace your paramedic science degree. Apart from that, my name's Tommy, this is Paramedic TV, until next time.